So we'll continue with some of the Chapter 2 concepts, and we'll talk about bone stress injuries, which this is the current term that we're trying to use to replace the term stress fractures. So some information here. 40% of bone stress injuries in the NBA have been shown to occur within the first 6 weeks of the season. And we know that within the first 6 weeks there's a lot of accumulative loading and impact that the player sustains, so the lower extremities can be susceptible to a lot of these forces because they're not accustomed to them coming off the off season. In the military, we know in the basic training and the beginning of transitioning to the military, that's the most common time to get these bone stress injuries. There's been some other reasons for that if you look at possible footwear and shoe wear and other conditions with the running that occurs in basic training. But ultimately, we know that going from a low stimulus to a high stimulus, especially in a repetitive load situation, can cause issues. So this ties together with Wolff's Law. So if you're not familiar with Wolff's Law, I'd like you to look that up. You could look online for that, or you could look at the textbook on page, 65. It has a quick summary of Wolff's Law. So I'll give you some time here. I'll pause this and just let you look at that, and then I'll have a question asking you to summarize Wolff's Law. Alright, so let's talk about some of the different loads on bones. Obviously, you have the unloaded bone scenario. This would be if you're laying down. There's not really any compression there. But as we go from a horizontal to a vertical position, we're going to have the compressive forces. So you have force coming from the inferior distal aspects. You have that ground reaction force, and then you have that gravity causing that consistent force on our bones. So there's compressive loads. There's also tension loads depending on the scenario. So let's say you're going skiing and you're on the ski lift, and your skis or your snowboard are on your feet, dragging down, pulling, and this is the femur here, but let's say it's pulling on the tibia at your ankle. So there could be a tension load here, and you can imagine tension loads, or if you're upside down, there could be tension loads. There are bending loads that would certainly go through here. What is this load here? That's going to be a shear force. So when you have a force in one direction on this side and in the opposite direction on the other side, that's a shear force. And there's also a twisting or a torsional force. And all of these different forces, if with enough magnitude or a great acceleration, could produce significant force and could cause a fracture, or they also could cause a stimulus of growth. So these are not necessarily bad or good forces, but if they are delivered in the right mechanism over time, they can strengthen the bone or they could break the bone. It all depends on the scenario. So looking at this summation, I think this is nice. So if you look at the types of ways that we load our bone, so there's some devices out there. You may have seen these vibration trainers. It's a relatively low magnitude, but a high frequency. So just shaking or vibrating the bone, high oscillations might stimulate the bones. There's some evidence to suggest that might be true, and there's other evidence to suggest that it doesn't create enough substantial magnitude to create those effects. What about walking and running? This depends on the amount of magnitude that is associated with that. There's also impact and resistance training, so high loads. Now, which look you're seeing here is someone's jumping off a box and then jumping up, so this would be a plyometric type activity, which can be a relatively low weight that you're doing this with, but because it involves acceleration, rapid deceleration, or negative acceleration and rapid acceleration after that, it is a possibility to create a significant increase in bone strength or bone density. It's also a possibility to create a bone stress injury. So you should be aware of this formula. So bone stress is going to be equal to the magnitude of the load, or this would be the quantity or the amount of the load, times the number of loads. And so this is a cross-section of an individual's femur, and so you can see this cross-section. So you can see the bone and and other tissue around there. And then you can see the middle portion of the bone, and then how this changed over time. So of these images, which one has the greatest bone density? Yeah, so this one right here, you can see the thickening here. This would be the greatest bone density. And then if you're looking more at the trabecular versus cortical here, so you can see what does bone density look like. So you see how it's almost like these hollow points within here, this webbing type effect. You see how there are less hollow spaces and more connected spaces, more hollow spaces here, and then you're looking at the connections here as well. But do you see these gaps? So this is the cortical bone density, whereas this inside here is representing the trabecular bone density. So cortical versus trabecular bone density. And in either model, we're trying to look at magnitude of the load and the amount of times that the area was loaded. Essentially, if you get to the blue line here through either a high load or you get to the blue line through performing a low load but a lot of repetitions, you might have a potential injury. So if you run without wearing any extra body weight, but you run a lot, you get a lot of mileage, even though you're not impacting at a high level, the cumulative stress of all those individual strides, 150 strides per minute or so, all that cumulatively takes a toll on the bones. Or what if you jump from a high surface? You saw the wrestler video before. What if I only do it once, so it's a very low repetition, but if it's a high magnitude of the load, that can cause injury as well. And that injury could occur at the cortical or trabecular levels, but what this is showing here is that trabecular bone injury tends to be a lower load, higher repetitions, whereas cortical bone injury tends to be a higher load, fewer repetitions. But either way, bone stress is the magnitude of the load times the number of loads. So here's a good example of some research that was done looking at stress fractures or bone stress injuries in military unit from a big span of time, 1983 to 2015. This is really just FYI. Looking at the following variables. These variables have been suspected as having a potential influence on an individual's likelihood or predisposition to get stress fractures. So if you look at these, increasing sleep to a mandatory 7 hours a night, well, changing that variable, does that impact a BSI? Adding more comfortable boots, so that gets to the footwear, shoe wear issue. Adding a physical therapist to the military unit in particular, adding lower extremity strengthening exercises, reducing marching by 33%. So this gets to the repetition. What if we haven't changed the magnitude of the load, but what if we reduce the repetitions of the load? Or what about training in a flat terrain? A flatter terrain is going to decrease the magnitude because if I'm running down a hill, I'm going to be landing with a higher magnitude of force. And so with this, by changing two of the above, so any two of the above, it seemed to reduce the bone stress injuries by approximately 33% in terms of the severity of the injury. But in particular, training in a flat terrain seemed to have one of the strongest indicators of reducing that. So it gets back to the magnitude of that. So here's a little video. Let's see if we could play this video here. There we go. Okay, so I took this video at the YMCA in Roanoke, Virginia. You can see this guy is really going at it. So he's not doing a very high load, but he is doing a good amount of repetition. So what do you think this? If he's doing a high repetition but a low load, is he more likely to stimulate cortical or trabecular bone growth. What do you think there? Okay, good. Now let's talk a little bit about aging and load and what happens with aging. So here's a nice little chart. It's good to know this chart. I'll give you some time to just look at the chart and to look at the different tissues. How does having a decreased load, becoming more sedentary or less active, however you'd like to phrase that, what happens to the tendons and ligaments? Okay, so you can see decreased, 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 decreased. Throughout all these different structures, having a decreased load will cause decreased proteoglycans, decreased collagen synthesis, decreased, decreased, decreased. Now you are going to get an increase in adhesive formation in the synovium, so that's that synovial membrane adhering to itself. You are also going to get fibrofatty tissue deposits into the joint space, essentially other things invading the joint space, and that's going to definitely cause issues with friction. What about increased loads? Increased loads causes increased events that you can see here, and so forth. So that's a good summary slide to know there. Little break slide for you.